Hey folks, Doug Blake with Body Design University. In this video, I want to take you into chapter 16. It's the core training concepts because I've had some questions on the difference between the local and the global core musculature. Really simple, very straightforward. So this will be kind of a review of that area of the chapter. But again, it's chapter 16. It's an important chapter from a testing perspective. And there are some key elements here that you do need to memorize. And if you're on page 513 with me, that's the beginning of chapter 16. There's a couple of terms that you do need to know: core stability, core endurance, and core strength. One of the bigger things for NASM is that you understand exactly what the core is, and it's not just your abdominals. And this is important to know because when it comes to actually training, strengthening the core, providing balancing within the core musculature itself, as well as proper balancing of strength between the local core and the global core muscles. NASM is pretty big on this, and I think it's important as well. Just keep in mind that from a purely testing perspective, they're going to want you to know basic concepts. They will want you to know the names of certain muscles, obviously, and you should know why you would be doing certain protocols over other protocols. And really, what I'm talking about there is what they get into when they start talking about the actual program design that you would be using. And I'm trying to search here to table 16.2. So I'm not going to get that far into this in this video, but I just want you to know that understanding the local and the global core musculature is important in this particular chapter. Now, yes, I know what you're saying. If you've read through the previous chapters, obviously they go into a little bit further on the local and global muscles. But what I want to do is talk about it from the perspective of chapter 16, because really on this particular area, your goal is just to memorize the muscles, what their actions are, and understand a couple of definitions. I also need to make sure that you know on page 517, if you're looking at the primary actions, let me just help you out right now. If your textbook uh, gives you the primary actions of the erector spinae as trunk spine flexion, as mine did, rotation and lateral flexion, please understand that flexion is the wrong word. It should be extension, trunk spine extension. So the erector spinae, and again, I had somebody actually mention this to me, and I had already seen it, but they were confused because the editor got it wrong. The word should be extension. So trunk and spinal extension is what the erector spinae do. But that's not a big deal. You just do what I did. I just literally crossed out flexion and wrote the word extension in there. So again, in chapter 16, when we're talking about the local and global core musculature, the goal is just to kind of finish up what you had learned earlier and memorize the name of these basic muscles and what they do, and then to also understand some of these basic concepts. And real quick, the two that are the most important is what's known as the drawing in maneuver and bracing. And that's really what I wanted to go over, give you a quick review on this. So chapter 16, page 513, know the core stability, core endurance, core strength, pretty straightforward. And then you're going to get to the two components of what we call the core, or the LPHC, the lumbopelvic hip complex, and that's going to be in table 16.1. It's actually really important that you know these muscles. The local core muscles are those that are in and around the spinal column generally. So you have what are known as the rotators, which stabilize and rotate the spinal segments. You can see this is page 515. It's in yellow. Googled 3D or something like that, and you can see how these things work. Nothing particularly difficult. But local core musculature is generally intrinsic to the spinal column, rotates, turns the spinal column, assists with global muscles to extend or flex the spine, So you have the rotors, which stabilize and rotate spinal segments. The multifidus, now you'll see basically it rides over the top of the rotors. They also stabilize, they extend and rotate the spine. So again, we're talking about something very similar to the rotors. So rotors, multifidus, the transverse abdominis. Now, again, most folks don't necessarily see the transverse abdominis as a local, but in reality, it is an intrinsic girdling of muscle around that entire pelvic area. And again, it's a pretty good. They give you a pretty good picture of it, but in reality, you got to see the entire torso turned around. So the transverse abdominis increase intra abdominal pressure. So when you're going like this, this is one of the classic maneuvers that you can use to strengthen the core musculature. But the transverse abdominis are highly regarded as sort of the main players with the internal and external obliques to ensure that the abdominal region itself, all your visceral organs, are held tightly in place. And so those are your transverse abdominis. The diaphragm regulates inspiration. The diaphragm, by the way, pretty much secures the superior aspect of what we call the lumbopelvic hip complex. So the LPHC is essentially that region of the abdominal area that is superiorly located or targeted off by the diaphragm at the top superior, and then the pelvic floor. And you're going to actually see that on the next page. And then, of course, the entire lateral aspect of the abdominal region, again, transverse abdominis. So diaphragm regulates inspiration. It when it contracts, it pulls down and inflates the lungs. But that is a local muscle. We continue on page 516, and you have what's called the pelvic floor musculature. It's actually not just muscles; it's a very sort of thick mat, so to speak, if you want to say, of ligamentous material, cartilage, things like that, that are holding that lower component of the pelvic region in place, so that your entire visceral organ uh, area does not fall through your pelvis, right? So it supports the contents of the pelvis. In other words, your entire visceral organ section. The quadratus lumborum, lateral flexion of spine, elevation of pelvis. Again, by the way, you can't see nor can you palpate a muscle like the quadratus lumborum. I mean, I guess if you're getting a massage, maybe your massage therapist can kind of get in there. But that puppy is deep inside, deep inside. Now you can probably get your hands and try to get in and palpate it, um, but it's a tough one. It's a tough one to palpate. So, but the point is that its primary function is lateral flexion of the spine, right, side to side. Please don't be doing these exercises trying to train your quadratus lumborum. You're going to hurt yourself more than anything. So those are your local that's the local musculature. Now, again, NASM had already gone over with you kind of these areas, quadrants, areas of the local and global musculature. But now we're into the global muscles, the rectus abdominis. Obviously, that's going to be the more prominent muscle that we look at when we talk about the core. Again, people will confuse abdominals and core as the same thing. It's not the same thing. The abdominals are part of the entirety of the core musculature, with the rectus abdominis acting as the primary spinal flexure. So trunk, spine flexion, rotation. Yeah, okay. I'll go with it. And lateral flexion. It's not their primary movement functions at all, but do they assist? Sure, a little bit. I wouldn't have put that in. I would have just said trunk spinal flexion. By the way, the rectus abdominis and go to page 517, the erector spinae are antagonistic muscles, which is why when you see trunk spine flexion for the rectus abdominis. That is correct. But when you see trunk spine flexion, no, that's not right. Should be extension. Remember, I went over this. So external obliques, external and internal obliques, they are both flexors of the spine, right? When they both work simultaneously, when both of the external obliques and both of the internal obliques contract simultaneously, they will work in conjunction with the rectus abdominis to flex the spine forward. Of course, they are both lateral flexion and contralateral rotation. So remember, lateral flexion is within the frontal plane, side to side. Okay, but they are also, in one sense, more of a their secondary function is for rotation. So lateral rotation one side to the other. So that's going to occur in the transverse plane. So yes, even though the internal and external obliques do function to provide frontal plane or lateral flexion, meaning side to side, like you do these side bend type of things, don't do them. I'm just saying as an example. In reality, it's more rotational that they are more involved with because of the alignment of their fibers. The external obliques work with contralateral rotation. The internal obliques, because they literally their fibers run obliquely to each other, are ipsilateral rotation. And so when one external oblique over here works to pull one way, the internal oblique of the contralateral side works with it. And that's why rotation involves one side external, the other side internal oblique, right? Because their fibers run in a different diagonal direction. And so they work in conjunction from a contralateral perspective. The erector spinae, we just said, and isn't that interesting? Because I want you to look at this. Um, People say that the erector spinae are the lower back, and I will agree with you that for the most part, that's what they are. But in reality, look at the size, look how much muscle tissue is involved with the erector spinae. In reality, the erector spinae are much longer and affect much more of the spinal column than just the lumbar spine. They affect pretty much the entirety of the lumbar and thoracic. In fact, all the way up to the cervical spinal vertebrae. So just keep that in mind. Your lats, okay, trunk, spine rotation, in addition to shoulder extension, adduction. So the reason they're saying trunk and spinal rotation is because they're speaking about the lats contribution to movement within the core component of its activity. The lat's primary function is to adduct, extend, and medially rotate at the humerus. But because of their origin, they also act to affect spinal and trunk movement as well. And that's why they're saying that trunk spine rotation, right? In addition, now, if I was looking at it from the standpoint of purely how it functions at the shoulder joint, I wouldn't be discussing that at all. Okay. Last and finally, global muscles are the iliopsoas. It's really the iliopsoas is actually a functional combination of the iliacus muscle and the psoas. It's going to be involved in hip flexion. They are, for the most part, they're like the primary hip flexors. Their line of pull is so direct that they have a tremendous amount of pulling power to flex the hip. So again, just wanted to, and that's page 518. Please understand the importance of knowing the names of these muscles. Again, you would have already gone through and seen, a little bit more in-depth explanation. But again, once you get to the core training component of the text, core training, chapter 16, you really want to understand the names of these muscles and what they do and how they are involved. So if this was helpful, please write the word understand in the comments section. Remember to give us a like. If you haven't done so, please subscribe and share the video if you want to. If you do have questions, you can let us know. Write them in the comment box below, of course. Have a great week. We will see you next week.